Wearing surgical masks can reduce COVID-19 spread by as much as 75%, study claims. Researchers carried out the study in response to world leaders and the WHO questioning whether masks were effective. I'm not one for conspiracy theories usually, but I feel like masks not being effective at stopping spread was deliberate misinformation to avoid a run on PPE so that as much could be, justifiably, kept for healthcare workers as possible until such time as PPE production stepped up. As other people pointed out, this study is not linked in the article, and is conducted on hamsters. The study saw his team use 2 cages of hamsters in 3 different scenarios. One group was infected with COVID-19 and the other was healthy, with a fan used to push air towards the infected animals, some which did not show symptoms. Researchers said they found that without any masks between the cages, 2/3 of the healthy hamsters were infected within a week. But when they placed masks on the cage with infected animals, the infection rate dropped to just over 15%. The infection rate dropped by about 35% when masks were placed on the healthy hamster's cage. It doesn't list what number of hamsters there are, and I'm not sure placing a mask on a cage then blowing air with a fan is necessarily a good analog for how people use masks. On a study of 2 groups of hamsters, that has not been peer-reviewed. Is this really news? This experiment is ridiculous. The study saw his team use 2 cages of hamsters in 3 different scenarios. One group was infected with COVID-19 and the other was healthy, with a fan used to push air towards the infected animals, some which did not show symptoms. Researchers said they found that without any masks between the cages, 2/3 of the healthy hamsters were infected within a week. But when they placed masks on the cage with infected animals, the infection rate dropped to just over 15%. The infection rate dropped by about 35% when masks were placed on the healthy hamster's cage. A fan blowing air from one hamster cage to another does not replicate human behavior in any way. Similarly, part of the problem with masks is they are worn by humans, who will fiddle with them, not fixed perfectly over an entire week. In order for this experiment to be more closer to reality, he should have fitted up a mock shopping mall or even city block, hamster-sized, then fitted little hamster-sized masks to some of the hamsters. And then let them loose in the mock environment. Important caveat, this is on hamsters, and the study doesn't appear to have been published yet, just a PPT. Sorry, but what kind of study is this? Mask wearing is complex. There are questions about whether mask wearing in countries that aren't used to them leads to more face touching, whether taking the used mask off leads to cross-contamination, how good the fit is, the dynamics of droplet transmission with the resting/active human, whether people wearing masks gives a false sense of security and leads to slightly less social distancing, and they model this with 2 cages of hamsters with a fan blowing. I can think of few less effective models on the face of it. And gloves reduce it by 0%, or at least by so little that gloves aren't worth it. Soap and water is the best thing. In hamsters. Not peer-reviewed, uses hamsters, and the article says near the top it reduced spread by 75%, but further down in the article it says researchers stated they saw a 50% reduction in infections. This doesn't appear to be high-quality research and also doesn't appear to be a high-quality article. Actual surgical masks have protective properties against the spread of disease. It's almost like we designed them that way. The question is whether or not the ones available to the public, cloth masks, do anything. Did anyone read the story? It's a limited experiment run on hamsters and the conclusion is that it stops infection by reducing spread from asymptomatic carriers. This is only key in enclosed and high-traffic areas. Not saying masks don't help, they do in some degree, but this study is shit. I don't think the argument is the effectiveness of the mask as a tool, the technology works just fine, but more that people are fuckwits and will misuse them, potentially carrying a little pool of it around, to touch just before touching a door handle or whatever. Taiwan enforced a strict rule requiring masks for everyone using public transport and we have had almost a full month of no local cases. God, I hope wearing masks when you're sick becomes more mainstream. If people insist on coming to stores, work or classes with a cough and a runny nose, the least they could do is wear a mask. Lots of people saying this study is ridiculous. But actually, why do we even need a study? HK is the best real-life case study you could follow. In the post picture, you see HK, which as of today is pretty much open and same, if not more, foot traffic as usual. And even 2 to 3 months ago during the peak here, business were still operating and decent numbers of people out and about, going to office, exercising, etc. But everyone has had masks on this entire time. If you don't have one on, you are noticeably shunned and people will keep even more distance from you. And guess what? It undoubtedly has helped to stop the spread. We had 0 local infections for over 3 weeks, until one lady got it from her pilot BF, I think, this past week, which has raised fears of another wave, but it seems under control. Edit: yes, it is not only the masks that led to HK's successes. Early action and lack of resistance from the public regarding quarantine made a huge difference. However, most of us here still believe that masks have played a huge part in preventing further spread despite a prolonged reopening of the city. Still, fingers crossed nonetheless. Hamsters aren't people and hamster cages aren't the real world. Actual CDC experts studying actual humans have concluded that face masks have no statistically significant effect on transmission. https://www.nc cdc.gov/id/article/26/5/19-0994 This is why, back in February, they were on Twitter telling everyone to stop buying masks. In fact, masks can be hazardous to your health because they impair breathing and park a damp, dirty bacteria factory right in front of your respiratory system. The reason the tune changed is simple: social control and panic mitigation. They give people something to do, something to argue and fight with other people over, and something to make them feel like they have a little control over a situation that is completely outside their control. Your shitty cotton t-shirt mask doesn't actually protect you against anything but your own anxieties. And that's fine, because if you're under 60 and not in a nursing home, your chances of surviving the virus are over 99.9%, and your chance of getting it in the first place is probably under 50%. No shit. Will you all stop making fun of us in Japan for wearing them during flu season? There is a meaningful distinction here that the title obscures. The masks help reduce the spread, but wearing a mask doesn't meaningfully reduce your chances of contracting the disease. This is the point medical professionals were making. The process of putting on, removing, or adjusting a mask leads to you touching your face more, and could give you a false sense of security that encourages more face touching. What a mask is good for is preventing you from spreading the virus once you already have it. This is why it reduces the spread. It makes me depressed that people need to be convinced wearing face masks helps stop the spread. If an older study had anything to say, I figured this much, although the study I refer to had to do with using mask to prevent spread of the flu. It was relevant though, as the flu spreads similarly to this disease and is comparably contagious. The study I refer to had around an 80% reduction of spreading the flu, and 95 were even more effective, reaching around 85%, but I used that any other way would be via another route. There's no doubt that properly used masks have some effect on the spread of a virus. But the shitty mask etiquette I have seen probably outweighs the benefits. Old lady in the chemist with mask on, unable to speak loud enough to get the pharmacist to hear her, meant she leaned into the face of the pharmacist, who reciprocated by leaning towards her too. This is why the science is divided on this subject.